Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, thank you for being with us today.
Thank you, Erika.
It's been a few weeks since we have last spoke to our viewing audience, and of course the cases did reach an all-time high a few weeks ago, and we have seen those cases, at least hospitalized cases, start to decrease. What is the overall vibe at the hospital, and what are we seeing?
Well, 2 weeks ago or so, we were hopeful that we would get beyond this next wave, and sure enough, we have. And I think it's a credit to the community, the region, for masking up, remaining socially distanced from one another, and it's paid dividends. Case volumes are coming down inside the hospital, and I'll tell you what those are in a minute. The number of positives in the county and the region are not climbing as fast. We are still having death associated with COVID-19, and everybody understands that the very, very sickest patients are the last ones to leave the hospital, and typically it takes a long time to get them well, or they don't make it. So unfortunately, we're still having high mortality, but that's beginning to slow down. So inside the hospital, a couple of weeks ago, we were at a high of 77, 72 was reported, I think, on one of our graphs. That dropped down into the 50s. This past week, we dropped down to 39 inpatient COVID patients in a hospital bed, and now we're at about 41 today. More good news is not so many mechanical ventilator patients. I think only 7 patients are on a ventilator. And then, what we're seeing is our percentage of positives through the testing that's going on throughout the system is coming back down. This past week, that positive rate was 9%. Y'all may recall I reported there was a day just a few weeks ago, it was as high as 26%, I believe it was. So down to 9%. And just to tell you how much testing is going on, we had a lot of questions about testing. Well, we're doing a lot of testing, and we still send a lot of tests off because the number of test kits aren't available for the testing platforms inside the hospital. And Erika, we have 3 testing platforms. They're very sophisticated, but we just can't get the testing kits because the supplier still can't meet the demand, although it is improving. But 23,000 plus tests have been conducted since the beginning of the pandemic throughout the system. Out at Smith Northview, we have screened somewhere around 16,000 people. Of the 23,000 tests, about 12,000 have been done out at Smith Northview through the screening center. So that's outstanding, creating access to testing. And again, the positive rate right now is about 9%. So COVID's still here. We're still treating patients. It's still very challenging. The COVID units are doing a great job. We're down to 3 COVID units now because we're not as high, but we have the capability of going back up should it come back. But right now we're hopeful that we're over this wave, and if we can keep doing what we're doing, I believe we can sustain this thing for a long time until vaccination and other types of preventive measures scientists are figuring out can help us out with this thing.
That's great to hear. I know testing is certainly a game changer to fighting this pandemic. I myself had to have my son tested not too long ago, and we used the Smith Northview campus, and the ability to be tested and have that result within hours really helps you be able to continue on with your life, knowing which way you need to go.
Yeah, and we're going to try to expand that. I want to talk about masks for just a minute. Then I'd love to tell you what we're going to do with the screening center out there as it relates to flu season coming along. But you all know we're trying to encourage masking, and there are those that just simply can't afford a mask. We're very proud. We've had about 60 to 70 business partners come alongside of our foundation, South Georgia Medical Center Foundation, and our hospital to purchase 10,000 masks that are being distributed. I'm pleased to tell you that we've delivered the first round of these masks to an assortment of agencies throughout the region, particularly in Lowndes, Lanier, and Berrien County. These masks are being given to people free of charge that cannot access or afford to buy a mask. And I just wanted to show you the mask. It's very nice, actually. It's a little bit of a designer mask. It has our logo on it. It can be adjusted behind the ears. It can be used and rewashed and reprocessed for use safely. And these masks are being given out free of charge. And I just want to thank all of the community members who participated in this, and many individuals and business owners and businesses and our employees contributed to this 10,000 mask campaign. Now back to the screening center. You know, we talk about COVID. COVID is on our mind all the time. Well, now we need to think about flu. We have to be preventive about the flu. Having a flu pandemic on top of a COVID pandemic could be very interesting for our community, so we're very interested in that. And we have the setup at Smith Northview for COVID screening. We are beginning to plan for flu symptom screening, flu testing, and that will be coming alive in the coming weeks. We'll tell you more about it, but it's very important, everybody, especially the older population in our community. Let's go to the doctor or go to the testing or vaccination center. Go where you get your vaccination and get your flu vaccine, and do it now. It's the safest thing to do. It too saves lives, and we invite everybody to do that. And we're going to participate in trying to help the community and our other members of the medical staff that provide this throughout their offices make this more readily available to the community.
Very good, because we have already seen flu cases.
We have had flu cases, and they are climbing, and flu season is here. And we've just got to do our part in preventing it. Okay,
very good. And Labor Day is approaching. Any thoughts on that as people start to get out more and possibly gather up?
I have to say what I've been saying, and again, I'm very proud of our community and the people of this South Georgia region for doing what's required. You've done it, and that's why the numbers are coming down. And wearing the mask and being responsible, personal responsibility, self-awareness around others, especially in quaint areas where ventilation is limited and can easily move this virus and our flu around from one person to another. Just asking you to maintain that discipline. I think if we'll do that through Labor Day, we will not have the surge that we saw after July 4th. You can just look back in the data. We had more patients after the holidays. Well, we're worried about that, but I have confidence in the community, and I just ask you all to do your part. We're going to keep doing our part here at South Georgia Medical Center. We have the capacity to take care of you. We're doing the other things that need to be done for the community's health, but we'd rather you not be here, honestly. We'd rather you be at home, safe with your family, and without the flu or this COVID virus.
Thank you, Mr. Dean. I know our staff are working incredibly hard because despite the COVID numbers going down, we still have a lot of people in the hospital needing other services. And so I know they've been really working hard, so we want to thank them. Right. We have a little video that we put together that just kind of shows the vast quantity of patients and days that we've been fighting this that we will link at the end of this video, so we hope you will watch that. And if you see a healthcare professional, thank them for what they're doing, because it truly is a service profession right now.
It is, and we can't thank them enough. Remember, a lot of first responders out there include at the doctor's offices, police officers, fire, EMS, a lot of people out there helping us. I'm a member of this community, and they're there for me when I need them, helping me be safe, and we can't thank them enough. Our nurses, doctors, and staff here at this hospital, thank you for your support, and we're going to appreciate them a little bit, I think, in this little video.
Yeah, thank you very much.